My name is Nick Pullis. I'm one of the hand and microvascular surgeons here at the Mayo Clinic. I have with me today a 46-year-old gentleman who noticed hand weakness 2 weeks after a right arthroscopic shoulder surgery. We're going to demonstrate here the strength testing of his radial nerve, starting with his triceps. So the first thing I'd like to do is understand his active and passive range of motion. So can you straighten your elbow out all the way for me? So he has full active extension with his triceps, and his active equals his passive, which means that he's at least a grade 3 strength of his triceps. Good, relax for me. Now I can provide some resistance, try and strain your elbow against my resistance. And he has good, strong resistance with his triceps, which I would grade a 5 out of 5. Thank you. Next is his brachioradialis. Can you, with your thumb pointed in this direction, can you bend your elbow up for me? Good. Again, with elbow flexion in neutral pronosupination, his active equals his passive range of motion. So I'm going to have him now do it against resistance. Bend your elbow up for me. And palpating his brachioradialis, which you can see very nicely here, he has full 5 out of 5 strength with brachioradialis. Relax. The next is to assess the supinator. So starting with your palm down, I'm going to check his passive range of motion and active range of motion. Can you turn your palm up for me? So you can see with a little bit of elbow bending, he tries to supinate. Good, relax. Can you try and keep your elbow straight while you do that for me? Good, relax. So that was his active motion. He has slightly more passive range of motion than active range of motion, so we would grade that at a 2 out of 5. And then to test whether or not he has some resistance, can you turn your palm up for me? I provide some resistance, and it is, in fact, weak in supination. Coming more distally, can you extend your wrist for me? Excellent. I'm going to relax for me. So he's able to actively extend his wrist against his full passive range of motion. And let's do that again. And as I provide resistance, there's just slight resistance to this, which I would grade at a 4 out of 5. As you see here, when he extends his wrist, when we ask him to extend his wrist, much of this is his wrist is radially deviated, suggesting that much of his radial wrist extension is coming through ECRL. Bend up for me, please. Okay. Relax. Can you try and extend your wrist out towards your small finger? Try and extend. And he's unable to extend his wrist with it ulnarly deviated. Try one more time. And I can palpate a slight flicker there, which I would grade as a 1 out of 5. Thank you. Concentrate is trying to lift that knuckle straight up. Relax. And one more time. And so I can palpate a flicker of the tendon to ECRB, which I would grade as a 1. But again, most of his wrist extension is through ECRL. Can you try and extend your wrist while ulnarly deviating, while bringing it towards your small finger? Relax. Try again. And again, while I can palpate his extensor carpi ulnaris, there's very minimal active wrist extension with ulnar deviation. Can you extend your fingers for me? So immediately when asking him to extend his fingers, we can see here that he's trying to flex his wrist to use a tenodesis effect. So to counter that, I'm going to hold his wrist in extension. Can you extend your fingers for me? And there's very little active extension there. He is strongly flexing his wrist and using his intrinsic muscles to straighten his IP joints, but he's unable to extend his MCP joints. Relax. And then one more time, extend. And while I can palpate the EDC, I would again grade that as a 1 out of 5. Examining the thumb, can you extend your thumb up for me, please? Again, he's actively flexing his wrist to try to extend his thumb and use a tenodesis. To combat that, I'm going to hold his thumb in position. And now that it's bent down, can you straighten your thumb up for me? Relax. As a passive range of motion is full, extend that thumb one more time. And he cannot achieve actively his passive range of motion. And one more time. So we would grade that a 2 out of 5. Lastly, checking his base of his thumb, I'm going to have you extend your thumb up one more time. I'm trying to palpate the first extensor compartment, which I can feel palpable. I can feel the tendon. I can palpate the tendons, but again, very minimal active range of motion through the first extensor compartment tendons. Again, graded a 2 out of 5.